Look, it's, of course, the time we spent when we started the show today was talking about doctors, this new law that was passed in Quebec, and the reaction from it, the fallout, I think, is probably more accurate from it, with many doctors, apparently, from what we heard this morning, already looking to get out. Easier to go to Ontario or New Brunswick, practice there. And, of course, you heard the clip. I think Jason just played it on the news. Doug Ford said, hey, open arms, welcome. If you're a doctor and you want to come to Ontario from Quebec, please. What did he say? They're going to roll out the red carpet for you. And actually, half kidding, said, call me. If you're a doctor and you want to come here, 1-800-DOUG-FORD. I don't know if that's a legit number or not. He made it seem like it was. He said, you can find it. I'm on the internet. So lost in the shuffle here, outside of doctors, of course, we haven't talked much about nurses, and we know the nurses have had their own issues with this provincial government. Roberto Bomba is treasurer of the FIQ. That's the biggest of the nurses' unions, provincial unions, and he's on the line right now. First of all, Roberto, thanks for being here this afternoon. I want to start by asking you, and I realize it doesn't directly affect you, but it indirectly, of course, it does. What do you think of what you've heard so far on this whole situation regarding Bill 2?
Well, good afternoon, Mr. Rand. It's been a while on our end. For us, it's quite clear whether it's the healthcare system or the education system, we'll never be in favor of a special bill with regards to settle collective bargaining. So it's a right, and people in the province, in Canada, have a right to bargain collective agreements, and they should reach an agreement. Unfortunately, it wasn't possible. And the government, which is a majority government currently, decided to pass a special law, which is Bill 2. Obviously, there's a conflict between doctors and specialists and the government, and we don't want the healthcare system or the registered nurses or the specialized nurse practitioners to be caught in this crossroad.
Well, look, one of the issues here is, and correct me if I'm wrong, because the note says the government says it's hoping that specialized nurse practitioners, as you've outlined them, right, they're called super nurses, will be able to fill the gaps by virtue of this new legislation on Quebec doctors. Does that seem fair, equitable? Is that what you expected?
Well, let's be clear. The super nurses or the specialized nurse practitioners, they play a vital role in the healthcare network. So they're specialized, whether in the front line, whether in the community, long-term care, also in mental illnesses, and they're not interchangeable resources. So they cannot be substitute for doctors. They have a wide scope of practice, they have a specialized scope of practice, and they're already actively contributing to patient care. So when we hear that the minister just decides to say that they can contribute with taking care of patients, well, we want to know, what does he mean by contribute? They're already contributing. They're already in family medicines. They're already in clinics. They already have a caseload. They cannot be substitute for doctors. So that needs to be very clear. They have a full caseload already. There's an issue of workload, so let's not put the burden on additional resources. There's a conflict right now between the doctors and the specialists and the government, so they got to settle this conflict and not bring in solutions that the specialized nurse practitioners will correct all the problems in the healthcare system.
Right. Okay, understood. By the way, with respect to your negotiations with the government, where are we on that? Because my understanding is Quebec recently cut specialized nursing staff targets, right?
Well, that's what brings dissonance. So the government says one of the solutions could be the specialized nurse practitioners. However, in the last year with the budgetary cuts, we know that there's some specialized nurses that are in training currently, and they've already been told by their employer, whether in the Montreal area, in the Montérégie area, that they will not have positions for them. So it's totally unacceptable. These are specialized nurses that are getting additional training. They're already working in certain institutions, be it in the CIS and the CIUS, in certain university hospitals, and they're being told that, unfortunately, when you graduate, we'll not have a position for you, and that's totally unacceptable.
I guess the question I want to bring up, and when I was asking our listeners earlier in the show to weigh in on this whole situation with doctors, and people say, you know what, I had one caller say, we have been, sort of fighting back and forth and back, not just through this government for the past 7 years, but really for the last 20 years. So how much has changed here, Roberto, with respect to the healthcare system getting worse or staying the same, or because it certainly doesn't look like it's getting better?
Unfortunately, I'm within my fourth reform of the healthcare system. I lived the first one, which was called the ambulatory reform with le ministre Rochon. After that, there was le ministre Barrette, le ministre Dubé. So what we're seeing is it's always these mega mergers. For them, it's the solutions. They put these mergers at an administrative level, and then they lead the population to believe that there'll be a greater accessibility of care and an improvement of care. However, at the front line, at the baseline, we don't see an improvement in terms of the care that is given to the patients, in terms of accessibility of care. So it always becomes an issue, and it's unfortunately because every healthcare minister seems to have a solution is let's merge these institutions. I remember in the 90s when we had thousands of healthcare institutions, and to my knowledge and my experience, we were better served as a population when we had thousands of institutions rather than one employer, one healthcare institutions from now on in the province of Quebec, which is governed by Santé Québec.
So I was going to ask you how you feel Santé Quebec has been doing. I think I understand now. That's kind of a pointless question. I said to someone yesterday, Roberto, when we were talking about this, I don't think I ever thought I'd say there was a worse health minister for Quebec than Gaétan Barrette, but I may be wrong.
Well, time will see, but unfortunately, from one minister to another, they always seem to have a solution, and it always seems to be the same solution. Let's create these mega institutions. Yeah. I recall when you had one hospital, one director of nursing, one director general, these individuals would walk within the institution. They would know their employees, be it a nurse, be it an orderly. They would greet them. They would know the units. They would speak to patients rather than be simply in the offices like there are now with these mega institutions.
Do we ever go back to that, or you think those days are gone?
Every government that comes in power brings a solution and they say, well, if possible, we will go back. Unfortunately, it's unlikely that we will go back. I hope that we go back, because you could have better quality care when there's a proximity with the staff, with the healthcare professionals, with the managers, where they have one priority. We want to become the best hospital in the province. However, when you make it a melting pot where it becomes one institution, you level everything to the lower level rather than try to improve quality of care. And so what you're doing is you're bringing the top institutions at a lower level because everybody has to become equal. So everybody has to share the same difficulties rather than be that institution that says we strive to improve, we want to be the best, and this performance allows others to say, you know what, if they can do it, we'll match them and we want to be better than them. However, when you put everybody together, there's no more comparisons.
Last question for you is simply this. I know the minister said this. I think the premier said it as well. The idea of this new bill, this Bill 2, saying that really what it strives to do is to make the system more efficient. Does that make sense to you?
Well, I will not get into the aspect of the remuneration because every bill he puts forward, this government believes it's to make everything better. However, concretely, we're not seeing it. Our healthcare professionals, be it in terms of workload, be it in terms of budgetary cuts in the last year, it's actually quite difficult currently in the healthcare system. And this solution of saying that specialized nurse practitioners with their great scope of practice will be able to contribute to taking on patients, they're already doing it. And it's quite ironic because 10 years ago, the FIC we financed the first nursing clinic in the province. We had to pay the salaries of a specialized nurse practitioner and a nurse clinician over a 2-year period. And we made a research project with 2 universities, Université de Montréal and Université de Laval at Quebec, to demonstrate that you could have an efficient nursing clinic. And we were able to provide 90% of the care that was required within the community. So this practice that has been going on for decades in other provinces, we had to fight for it in our province. And it's only in the last few years the government is realizing that the solutions can not only be family physicians and specialized physicians. Nurse specialized practitioners are the solution for the future of healthcare system. However, they cannot be at the crossroads, and they are not interchangeable resources with family physicians and specialized practitioners.
Roberto, I want to thank you for your time. Wish you guys all the best. Thanks so much.
My pleasure. Have a good afternoon.
You too. Roberto Bomba with the Fédération of Nurses in Quebec.
The newest tracks. Let's go. New music. And the next big thing.
Always on the new music first.
Your first place to hear it all.
'Cause you gon' like it, love it, wanna play it twice. Playing now.
iHeart New Music. Your digital station for brand new drops, fresh finds, and tomorrow's bangers.
I think we need something new.
Discover iHeart New Music. Always fresh, always first. Stream now on the free iHeartRadio app.